Hello, I'm Cristiana Ciro Santos. I'm a consultant rheumatologist from Leon's University Complex in Spain, and I'm also one of this year's EULAR TV reporters. Here we are at EULAR 2024, and I'm joined by Professor Nelly Ziade, who is an associate professor of rheumatology, public health, and epidemiology at St. Joseph's University in Beirut, Lebanon. First of all, thank you very much for agreeing to do the interview. We just had a lovely session on planetary health, which is an innovative session. We have never had something like that at EULAR. Could you tell us a bit about how the session went? What topics did you discuss?
Thank you, Christiana. Indeed, it is a very innovative session. EULAR has included this session for the first time because now we really need to look at the bigger picture. This session was convened by Professor Uta Kielz from Germany, and it has like three parts. The first part is a global part. So the key messages about the key definitions about planetary health, how it will affect us, are discussed. You know, there's a saying that when a butterfly moves its wings somewhere, there's a typhoon somewhere else. So we are all interconnected, and this is very important to realize that we are not like isolated in our diseases. Then the second part is the practical part. So what can we really do about it? Can I do as a person, as a doctor, as a patient, can I do something to improve my own health and improve the health of the planet as well? I just give you an example. For example, if you take the bike to work, you are doing the planet a very good favor, but also you are doing it a good favor to your health. So this is a practical examples, and a lot of examples are also presented in the session. And the last part, we are going to the rheumatic diseases, because the rheumatic diseases are particularly affected by the climate change, by the weather change, extreme heat, extreme cold, by the pollution. This all can affect the symptoms, can all affect the immunologic part of the disease, but also what is also very important to highlight, that it might affect the different people in a different ways. For example, it might increase the inequities. Some part of the world, people are more affected by climate change, by overheat, than other parts of the world, and this will increase the inequities among our patients, and we really need to do something about it.
Yeah, I think that was lovely. I think that you just made an introduction for my second question, which was actually on that. How does the climate change impact the management and the treatment of RMD patients? And also, what can we do about it, really? Yes. So I think just as a final, because I think those probably are the major highlights of the session, what are some of the practical steps that both physicians or patients can do in their everyday life and in their clinics every day for physicians to work on around this subject and about climate change in RMDs?
I think that the scientists have already done a very good job, but I think that for us it's still baby steps. We are just starting to understand the impact, the global impact on this on our daily lives. So I think that when you see the session, you will see that some practical aspects are presented, but also a lot of research is needed for the future and how to improve and implement what we have discovered so far in our daily practice.
Yes, I think that pretty much sums it. So this is a very new topic, baby steps, a lot of research agenda for the future. So that's lovely. Thank you very much. Thank you once again for agreeing to do the interview, and thank you all very much for watching.